What's up, guys? I'm Dr. Parker Bohm. I am a board-certified neurologist with a subspecialty in neuro-ophthalmology, and this is my channel, NeuroWorld-M.D. Welcome. The purpose of this video is to tell you a little bit about me, why I'm making this channel, and why you may want to listen to me. But I know I look like I'm like super young, at least for now. That's at least what my patients tell me. A lot of my patients say, you look like you're 19. But I'm 36, I have 4 kids. I did my medical school at University of Kansas for 4 years. And in between my second and third years, I got a master's in clinical research. And then after medical school, I did my neurology training at Mayo Clinic in Florida, which was really amazing because I got to learn from some of the world's leading experts in various subspecialties of neurology. And then after that, I went to Washington University in St. Louis and did a subspecialty fellowship in Neuro-ophthalmology, so kind of evaluating complex disorders affecting vision. And I am a neurologist. So what does that mean? I'm a medical doctor that specializes in the brain, but not just the brain, the nervous system in general, and various things that can affect the nervous system. So in neurology residency, that's when I was like pulling all-nighters, working a lot at the hospital, generally like 6 days a week, responding to stroke alerts, which were called brain attacks, where I did my training, doing spinal taps or lumbar punctures, and just seeing a whole bunch of patients and honestly basically learning how to be a doctor. So after high school, I did 14 years of total training before finally starting neurology practice in 2022. Kind of crazy. So as a general neurologist, I evaluate all different problems that can affect the nervous system. What do I mean by that? Well, evaluate people who come in with like weakness of their hand. Okay, so their hand is weak, or their arm is weak, or maybe they have one finger that's numb. They might come to a neurologist. Or maybe they don't have numbness or loss of strength, but their hand shakes. Maybe both their hands shake. Maybe their head shakes. Maybe when they walk, they drag their feet. Maybe they drag one foot. Maybe their feet are like stuck to the ground. Maybe it's a 20-some-year-old who's having memory and thinking problems. Maybe it's a 90-year-old who's having memory and thinking problems. Maybe somebody's had a stroke. Maybe somebody's had a seizure. Maybe somebody has had 50 seizures and their seizures are uncontrolled. Maybe somebody's concerned they have Parkinson's or ALS or a brain tumor. Maybe people have migraines. Tons of people have migraines and other types of headaches. Maybe somebody has had a spinal cord problem. So there are a ton of different things that we as neurologists evaluate and treat. So as a general neurologist, I kind of see that all. Although I do have a subspecialty in neuro-ophthalmology, so I do have some specific expertise in that. But anyway, as a general neurologist, I'm seeing kind of a broad spectrum of patients with a lot of different problems. And some of the problems turn out to not even be neurologic. So why did I start this channel? It's a good question. You know, several months ago, I was seeing patients and I just started to realize there were so many patients that I was seeing day in and day out for like the same problem. And a lot of them had been waiting months and months and months to see a neurologist because there's a huge shortage of neurologists across the country. And, you know, a lot of them actually probably didn't even need to see a neurologist. They just needed high quality information or to hear a doctor talk about, you know, some possible causes for their symptoms. So I just started to think, what if I could provide some high quality educational content on the internet, and how better to do it, you know, than YouTube. YouTube would be a great way to do it. So what if I could post videos on YouTube that instead of, you know, seeing 10 or 12 patients or something like that in a day, hundreds or thousands or eventually potentially millions of people could watch them and learn high quality, educational information. So I thought it would be a really great way for me to just use my skills and experience to provide just more information for people, because to be honest, a ton of people research their symptoms online, and I think that's good for the most part. I think it's important that patients are advocates for themselves and are researching their own conditions if they're not getting answers, because a lot of times patients can feel like they're being gaslit, when they go to the doctor and talk about certain problems and they aren't really addressed. So it's good that patients do their own research to some extent, but I mean, as you know, you can type in your symptoms on Google or use AI or something like that, and it may tell you, oh yeah, you probably have cancer or ALS or something bad, when it's something benign. And there's no good way for, an informational source on the internet like that to tell the difference, but to have some context around that information from an expert, I think could be very helpful for some people. And then the other thing is, while AI is awesome and it's an amazing tool that can be used, AI is not right about everything, and medicine's complex sometimes, and there's a lot of nuance to answer some of these questions. So sometimes it's helpful to actually hear somebody talking about some of these questions and having some of these conversations so you can get a little bit more context behind it rather than just looking on the internet. So those were some of the reasons. And another reason was I saw a young woman who had some major trauma in the past in her life, and without going into too much detail in this video, although I'll be discussing, similar cases in other videos, some of this past trauma that she had in her life was coming out in the form of neurologic symptoms, like years and years later. And I spent a long time talking to her about this diagnosis and how past trauma can actually cause current and future neurologic symptoms. And I thought I had really got through to her, and she basically had called our office, the next day or something like that, and basically said something along the lines of she didn't agree with what I had talked to her about. And I just started to think that, people, myself included, look to the internet as a factual source, kind of a third-party source, when you're not sure if, what a doctor's telling you is true. So if I can put out some content for you guys to be able to evaluate on the internet to inform your own views, then I think that's worth it. And again, even if I can help, 5 people or 10 people, it'll be worth it. So those were some of the reasons why I decided to start this YouTube channel. And another one of the reasons why I started this is because, I tend to spend a lot of time talking to patients, and I've actually had medical students and patients and other providers say, you're really good at talking to patients. And I think honestly it's just because I spend a lot of time talking to patients, and this is different because I'm just staring at this black abyss that is the camera lens, so I can't actually see you right now on the other side of this video. I can't talk to you specifically, but hopefully I can use this platform to give you a good idea of kind of how to think about different problems or different ways that you could talk to your doctor or your neurologist about, next steps in potential evaluation, or if you need to be worried or not worried about something specific. So what are my goals for this channel? Well, first of all, I basically want to put out a lot of educational, high quality content for you guys to be able to watch. And when I say you guys, I'm really talking about a very broad audience. So maybe you're a medical student or a neurologist. Maybe you have no interest at all in pursuing medicine or studying nursing or anything like that. You just think the brain's cool, or the nervous system is cool, like I do. And you just want to watch these videos to learn a little bit more about it. And that's awesome. But maybe you are specifically really interested in some of the things I'm talking about and some of these kind of niche topics, or maybe you have one of these kind of niche disorders I'm talking about. So let me talk about this channel specifically. It's called NeuroWorld MD, and this is my main channel. So what I mean by that is the content that I'm putting out on this channel is really designed for a kind of broad audience, so kind of a wide appeal to anybody who thinks anything about the brain or the nervous system or some of the things I talk about is somewhat interesting. And I have a second channel, NeuroWorld MD 2. Clever, right? And NeuroWorld MD 2 is basically going to be a hub or a home for a lot of the videos that are more niche topics. So maybe those are specific diseases, that are rare diseases. Or maybe they are videos about a certain medication or something like that, to where hopefully it can be an online library that you'll be able to kind of refer to if you have specific questions or if you want to research something specific within neurology. So that's kind of the idea behind this channel and then this second channel, NeuroWorld MD 2. And there is one other thing I really want to focus on, and I'm not just saying this for legal reasons, but it's because it actually matters. So this is an educational YouTube channel. And yes, I am a doctor, but I'm not your doctor. And what I mean by that is I can't hear what you're saying. I can't take a full medical history and do a full evaluation. So when I'm talking about these topics, you have to be the one to think about how they may relate to you, because I cannot diagnose and treat you over this one-way video format. So yes, that is a legal disclaimer, but it's also the truth. It really is. So I want this channel to be helpful for you, but at the same time, I can't be your doctor specifically. I think it's really important for you to have your own local healthcare provider, doctor, nurse practitioner, physician assistant, whoever you feel like you have a good relationship with that you can talk to about some of your medical problems. And I think that'll really lead to the best care for you specifically. And then one other thing just to mention is these views that I'm expressing on this channel, they're mine. They're mine alone. They don't represent any of the former institutions I've been at, my current institutions I'm at, or future. And anyway, I will be honest, it's intimidating to start a channel like this. I mean, I'm really kind of like putting myself out there on the internet, talking to you guys, spending time on this channel, and hopefully you'll find kind of a home in this channel. Hopefully you'll enjoy it and learn a lot. And I'm glad you're here. Stick around and type in the comment anything you might want to see or any questions specifically that you have for me, and maybe I can answer them in some video. So welcome aboard. Welcome to NeuroWorld MD. I'm Dr. Parker. Peace. I'm a board certified. Cut.